My name is Anesu Masunda. I'm presenting a topic, mental health and coping strategies. Question number 14 of the SEG diploma, higher access diploma in nursing. I'm going to talk about major sources and effects of psychological stress. I'm going to start with the work-related and financial stress. This is due to high workload and unrealistic deadlines, job insecurity and redundant fears, cost of living pressures, workplace conflict and lack of support, among other examples. We also have family relationships and social stress. This might be due to marital conflict and separation, parenting pressures, caring responsibilities, for example, caring for the elderly relatives. This might also be as a result of loneliness or social isolation. We also have physical effects of psychological stress, which includes activation of the fight or flight response, increased cortisol and heart rate, sleep disturbance and fatigue, might be also as a result of weakened immune system. We also have emotional, cognitive, and behavioral effects of stress, which involves anxiety and depression, poor concentration and decision making, irritability and mood swings, increased substance use, for example, increased medication use, trying to calm the body. We also have, we are moving on to the coping strategies and their effectiveness. We have several coping strategies. I'll start with problem-focused coping, which involves identifying and addressing stressors, time management and planning, seeking practical solutions. This is, however, most effective for controllable stress. We also have emotion-focused coping. This includes mindfulness and relaxation, cognitive reappraisal, counseling, and CBT. This, however, enhances emotional regulation, which is a positive aspect. We also have social support and community-based coping. This involves the inclusion of family and peer support, also workplace well-being programs, community mental health charities. This, however, has a protective buffering effect. We also have lifestyle and preventative strategies. This involves regular physical activity, a healthy diet and sleep hygiene, which is monitoring your sleep, getting enough sleep, limiting alcohol and caffeine. This, however, has a long-term stress resilience. That means it might take time to produce an effect, but it's worth doing or practicing. In conclusion, there are various sources of psychological stress, such as occupational pressures, financial strains, family life, and loneliness. In the UK, there is a proven increase in stress levels that are caused by the workplace and economic insecurity. This is according to a Health and Safety Executive 2023 and Office for National Statistics 2022. The combination of physical, emotional, and behavioral effects of chronic stress is long-lasting sleep disturbance and poor immunity through to anxiety, depression, and burnout. This is according to Mark Owen, 2007, World Health Organization, 2019. Stress is, however, not avoidable and irreversible. Its impact can be overcome with the help of a variety of coping strategies. Not only one strategy can actually help. Problem-oriented coping is especially helpful when the things that cause the stress are in control, whereas methods that ought to be used to manage emotional regulation are emotion-oriented, like cognitive behavioral therapy, that is CBT, and mindfulness. This is according to NICE 2022. Resilience is further enhanced by the social support networks and health lifestyle behaviors that serve as buffers. This is according to Cohen and Wills, 1985. However, more crucially, the success of coping strategies is contextual. It is also individual based. What works, this actually means what works with one person might not be the same that works with the other person. We also have to cater for individual differences as people are different. And it is also resource dependent, depending on the resources that are available. Thus, the policy of the holistic and integrated approach within the combination of organizational change, psychological support, and lifestyle change is crucial in promoting a long-term well-being. Early intervention in stress will not only enhance the outcomes of people, but it will also increase productivity and social response within the communities in the UK. Thank you.